Hello and welcome to this episode of Community Connections, airing right here on OROMIA11. I am your host, Anna Orr, and today we are talking about the African Mental Health Summit. I want to begin this episode with a special quote before I introduce today's guest. When the community speaks, data listens. Healing begins when we count what truly matters: people, stories, lived experiences, and policies. Today we're going to talk about the upcoming event that is taking place July 11th, and we're going to talk to the visionary Dr. Oni and Dr. Ola, who are co-founders and are going to be hosting this event coming up right here in the community. This is going to be a good episode and hopefully something that you will find inspirational and or educational. Stay tuned. Welcome to Community Connections, Dr. Richard Oni, as well as Dr. Tolulope Ola. Welcome back to the program. It has been some time since we've had you here.
Thank you so much for having us again.
Now, this episode of Community Connections is all about the upcoming event you all are co-coordinators for, correct? The African Mental Health Summit, taking place later on this month.
Yes.
All right. Now, let me know what led to the vision of the African Mental Health Summit. This is the 11th year.
Yeah.
But 11 years ago, what was the vision that compelled both of you to say, this is important and something that we need to do for our community?
Yes, I want to address that in the sense that 11 years ago, the awareness of mental health issues of Africans in Minnesota, it's like unspeakable. Nobody's talking about it. But the group wanted to know, and want all the Minnesotans to know, that mental illness has no boundary. Has no boundary in terms of culture, orientation, wealth, or poor. And so we want to have that awareness so that we can receive services. Because people think when you are from Africa, you don't have that need. And a lot of time, lack of request for service is not equivalent to lack of needs. And so we want to make this need known to the state of Minnesota. So that was part of why it started. What do you think?
Just to add to what Dr. Oni said, I will just want to say this, just to acknowledge his work and what he has done so far. Dr. Richard Oni actually started the African Mental Health Summit 11 years ago. He was the, he was the visionary, let me call him that. Mm-hmm. He was the one who started it. And he started with just about 50 people in attendance. And when I came to the US, he told me about it. I said, okay, I want to join you. And, he accepted me to be a partner and a co-convener of the African Mental Health Summit. And the first one we had together was the second annual African Mental Health Summit, where we had over 150 people in attendance, because we changed a lot of the strategies that we were using. We became more visible on the social media. We got more partners. And that was how, we've been doing it for the past 11 years. So I have been on it for 10 years. Dr. Oni, being the originator, the visionary, started it 11 years ago.
Now, you both are executive directors and founders of your respected organization. Dr. Ola, you are the founder and executive director of Restoration for All, or REFA Incorporated. And Dr. Oni, you are the executive director of Progressive Individual Resources Incorporated.
Yes.
What have you both noticed over this last, we'll say, 11 years that has helped kind of contribute around the stigma of mental health? You spoke a little bit about it, Dr. Oni, about it being so taboo in the African community and support being non-existent. But what are you all seeing day to day over the last 11 years in your respective practices?
Thank you so much for that question. For you to seek services, you need to understand an illness. So many people in our community have a lot of misconceptions around mental health. While some people attribute it to the spiritual, they always seek faith-based leaders and faith-based communities instead of actually seeking the conventional mental health treatment. And one of the things that we have noticed is the stigma and what is actually, propelling, most of this stigma. Dr. Oni will talk about that. He has a name for that syndrome. He's going to talk about that. But for me, I know if you understand a disease or an illness, you are encouraged to seek help. Mm-hmm. And that's exactly what we're doing in the community, for people to understand that mental health is not spiritual. Mm. You need to understand, even if there is any spiritual angle to it, there is something you need to do to understand it and to seek the necessary help. Dr. Oni, you want to talk about the syndrome that we have in our community?
Yeah, and I think the one of the propelling for us to continue is part that people now are accepting the word mental health. Mm-hmm. Unlike 11 years ago, when people will hear that and think you are the one that is crazy, because that is the only word they have for it. Language matters. Absolutely. And so we've been trying to really use user-friendly languages that people can understand. We talk about mental illness in terms of holistic approach, well-being, mental well-being of individual, and those are the areas that we've been focusing. And now there's more acceptance. The part that a lot of time what happened in the past is people will not talk about it. And they will say, if you go for counseling, people will say, why are you doing that? And so the community gossip attitude, which is the same thing as almost like a syndrome, that people gossip about it. They say, I saw her yesterday is talking to this therapy. And so we become very well known in the area of redefining what that means and using the language that people will understand more than before. So all these are very important for us. And then the fact that acceptance and the idea of before was the gossip syndrome that people have, that to say, somebody is not well, somebody is sick. And so because of that, we see that there's a progress because of that acceptance. Instead of focusing on treatment, we focus more on awareness, preventative, as opposed to curative, because a lot of Africans believe whatever doesn't stop you from doing your day-to-day is not illness. And now we are now working on that.
I think you're right about the landscape of it changing and being a little bit more acceptable in society. You have mental health days at work, there's mental health days for children. So we are starting to realize that this is actually more impactful than what we've acknowledged in the past.
Correct.
I think also during COVID, we realized how much people were dealing with.
Yes.
Even being a few years outside of that, I'm sure you both are still seeing residuals of that mental impact on people's families as well as on their individual lives.
True.
Correct.
Now, we are talking about the vision for this year's theme, and it is going to be, I want to make sure I get this right, elevating voices, expanding access, community interventions, driving mental health data and transformation.
Sure.
Yeah. Dr. Ola, do you want to talk about how you all settled on that theme for this year?
So, last year we had the 10th anniversary of the African Mental Health Summit, where we talked about, how we need to proceed in the following decade. And, when we were talking about how we are identified as immigrants and refugees, we see that there is a lumping when it comes to talking about receiving services. Under that big umbrella, it mirrors the help that we need because our experiences are different. Immigration is big. And beginning of this year, we had immigration policies changing that impacted a lot of people. So we thought it would be important for us to really have data, not those ones that are, quantitative alone, but qualitative. What people are saying, how are we able to make, this evidence-based so that when people tell their stories, what they are telling you, you can pick it up and turn it into statistics. And because of my background, I have my BSc was in demography and social statistics, I know how important it is to really be mindful of what people are saying. It goes a long way. And just because we have had a lot of suicide death rate, especially for youth in the community last year, we had more than 24. We saw the need for us to really, understand what people are talking about when it comes to their mental health, how they are expressing their signs, the signs and symptoms. If someone is telling you, I feel that there is a burden on my head, we need to take that into cognizance when we are referring them for services and not say, oh, that child is okay, that youth is okay. We need to listen to them. So from their stories, we want to turn that to statistics so that people will understand what people are saying and look out for, threats or maybe suicidal ideation, especially with this youth. It's only after they've completed the suicide that they will say, oh, he hinted at something. She hinted at something. Why can't we use what people are saying as an evidence and not only rely on the assessment, that we've been using? We need to change some things that we do right now. So that's why we have that theme for this year.
I think it's so powerful to recognize how statistics are contributory to policy, how they're contributory to us really acknowledging the impact of what is going on with people. We feel like if it's not someone we personally know or someone from our community that we can see, it's not happening, and that's not true. We know that so many aspects of mental health are silent killers. People are navigating things in their minds and in their hearts that they don't oftentimes give voice to.
That's very true.
That's very right.
Yeah.
Dr. Oni, did you want to talk about at all about the vision or the theme for this year's event?
Well, again, like she just mentioned, the theme is also to let people know that the community themselves are the statistics, and that we want the community to know that we are bringing what we found out about them to them. Because a lot of time when you study people, you don't come back to give them a result. And so we believe using this language, we also let them know that they have contributed to our findings as opposed to hiding it from them, so that they can now see and be able to contribute more and be more impactful than the people's report, not our report.
I think that's very important to be able to hold a mirror up to the public and let them see what we're really up against. Now, this summit is currently open to the general public, mental health practitioners, people that experience mental health themselves, and those that are in their networks that are supporting them while they navigate mental health. Can you talk about what that large range of participants means to you all as conference coordinators?
Well, they do mean a lot to us because when we call and they come, we know they are interested. We call their interest right there. And the fact that they can come, and part of them, some of them will participate in the paneling, whereby they will be asking questions. The public will be asking questions that we already prepare for them to respond to. I think that is very exciting. And the fact that when you give people responsibility, they become responsible. And so we want them to be part of it by giving them some questions to chew on, especially policy makers that made policies. They are going to be there this year, and we're going to ask them some poignant questions as to their own area of interest in this summit and going forward, what they have learned and how they can continue to contribute to that. That was why the planning committee involved policy makers like House of Rep, senators, and people from the governor's office.
That's important to have those connections, people that are able to affect change, but they're able to connect with you all and hear what's happening in real time.
That's right.
And hear from the community at large because they're in that room.
Yes.
That's true.
That's right.
I think that's very important. You all are partnering with some community sponsors. You've talked about some civic leaders. You all had a host of them on your website, from NAMI to so many others. State Department, there's so many different ones that are lending themselves to help you all make this summit what it's going to be. What has these partnerships meant to you all?
Dr. Oni, you want to take that?
No, I want to take that.
So I would say that this partnership means a lot to us. It's very foundational. We know, without these partners, we wouldn't have come this far. It's with the support of our partners, because when we talk about partnership, it's on different levels. There are some partners that we have that are community partners. They bring attendees. They are like gatekeepers.
Yeah.
They tell people in their community about this event, and, they tell them, I was there last year, and this year, I think it would be good for you to be in attendance. You're going to learn a lot. Words of mouth. They do that for us. Also, we have partners who are funders to help us pay, for the space. We use a Heritage Center. That's a very nice place that people talked about last year, and they wanted it again this year. Though expensive, but we are able to afford it because we have sponsors who are supporting us on this. So we want to say a big thank you to all our partners and sponsors. We appreciate them so much. Without them, we wouldn't have come this far. This is the 11th year, and they've been very consistent in their partnership. We appreciate them so much.
I think that is very important to recognize that we lift as we climb. And
Yes.
so there is a part that everyone can play. They may not be as the visionary, Dr. Oni, or they may not have the connections or the statistical prowess that you have, Dr. Ola, but they can lend themselves, whether it's in showing up and lending their voice, or it's giving dollars to make sure that poignant things like this take place in our community.
Yeah. And it's very important, because when you have a vision, you can't carry your vision alone. You have to have people to carry that vision with you. And that was what happened when Dr. Ola came on board, to carry that mission and vision. So it's like, they said sometimes that when you dream, you need to have co-dreamers so that your dream can go further.
Absolutely.
And I think that is what is happening here with the community partners that we have, because they are helping us more to grow further.
What do you all want people to take away from attending the event?
A lot. I think the most important thing that we want people to take away is not for us to talk about the challenges in mental health in the African immigrant and refugee community, but we want us to really look at the prospects and the opportunities that we have in making a change. We know it's an ongoing discussion. We cannot finish it, but the ones that we decide to attend to this year, which is around data and transforming the community interventions, I think, that's what we really want people to support us to do this year. That's what we want them to learn, and then take some of the things we have to say back to their practices, back to their communities, so that people will elevate what clients are saying, what patients are saying. If I'm telling you I'm not okay, you shouldn't be asking me, why are you not okay? Because you're not the one paying the bills.
Right.
We've had that in the community. So, parents telling kids, what are you depressed about? We need community members to understand when people are talking about mental health, they need to listen. It's important. Don't trivialize people's signs and symptoms. When people are telling you they are not okay, if a child does not want to go to school, you need to dig deeper. Understanding mental health issues, you need to dig deeper. We want our community members to understand if a child is telling you something, they need to make sense of whatever the child is saying.
I think that is so necessary. And I thank you for highlighting the concept of community intervention.
Yeah.
Because if we think about it, our kids spend more time at school
That's true.
during the 9 months than they spend in the home with us.
Very
And so if teachers are saying they're recognizing the change,
That's
if
right.
kids are saying to us, like you said, I don't want to go to school. You're having more days where you don't feel well than you are to, I'm going to get up and go.
Yeah.
If you're missing work, if you're not showing up at church, if you're not showing up at the gym like you used to, and people are starting to inquire, we might need to start to analyze, is something happening deeper, and check in with our community. I think that is very necessary. Now, what can attendees expect on the 11th of July?
Wow. We have a packed agenda. Yeah. So as we are learning, we will also be having fun. And then, we will have to, be truthful with one another. Panel discussion is a time to really hear from policymakers, because we have the panel one discussion, which is around policy to practice. And also the second one, how we want to use African wisdom, because we have a lot of assets in our community. Why can't we, really leverage what they have to offer? African, wisdom, values, bringing it in as part of the things we do to support our kids. We've learned a lot in the last 1 year. We had an African Youth Mental Summit, where we had, youth being panelists. And, fortunately, my daughter was one of them. I had something I've never heard from her before. She said, I tried to be someone else in school, and I tried to be someone else at home. That's for me, speaks volume. That's around cultural identity. You want to belong when you're out of home and then be another person. So we don't want them to struggle with that, concept of otherness. Be who you are. It helps you a lot to have your self-esteem, your confidence, and a sense of belonging. So right now we are really advocating for us to have probably, Black African immigrant and refugee, because of our lived experiences that are different when it comes to, talking about Black mental health issues. So
I think that is very important.
that's what we're going to have. Yep.
Now, there will also, there is a need for registration if they want to join you on the 11th at the Heritage Foundation in Brooklyn Center. At the Heritage Center, not Foundation, the Heritage Center. I want to make sure I'm clear on that so that nobody on the 11th is calling us saying they are at the wrong venue. They don't see anyone there providing information. It is the Heritage Center.
Yes.
But there is registration required for attendees. Can you all talk about that process for anyone that is watching this and is saying to themselves, I think I need to go to this?
Yeah.
Well, there is registration because it's so expensive too. We have to pay for CEU for all the board of the professionals, like 5 different boards: psychology, social work, behavioral health, licensed marriage family therapies, substance use disorder. So we have CEU for those professionals, which sometimes is very hard for them to get by not paying for it. This time around, we pay $135.23 to have lunch, breakfast, CEU, and knowledge. And so there's a reason for that. And a lot of people already know that. And on top of that, now we're giving scholarship for people that can, so that we can have outreach to everyone, that people can apply for scholarship, even though it's limited. It's also another way to let people have knowledge or know about this. And that is how we've been doing every year. People love it. In the afternoon this year, we do that every year to help people, to recognize people by giving them awards. We have awardees, number of awardees, maybe 6 this year. And this has been part of incentives for other people to be able to support next time around, because somebody get an award for being part of us all the year. So that is what that fee is for.
And people will be able to register on the website, which we'll provide a link for here, for them to navigate the homepage, find out integral information for the day, as well as to see some images and things in the past of the events that you all have had, to kind of familiarize themselves before they come into the space. I think that's wonderful and really accommodating to people that may experience some type of anxiety going into new spaces. If you're able to see images of where you're going to be, you can start to acclimate and feel a little bit more at home. So I think you all are very intentional about the way that you all are putting this together and presenting it to the community at large. Sounds like a wonderful time. Now, you spoke a little bit, Dr. Oni, about the awards. Dr. Ola, can you talk to me about the 2025 African Mental Health Summit Award recipients? You guys said that you are going to be giving awards for being a part of the event and things like that, but how did this come to be?
Yes. So over the years, we, tend to look at people that are resilient in the community and really talking about mental health. Even though it's difficult, they still take it upon themselves to get the message out. They've been very supportive, in planning the African Mental Health Summit. And we see that the only way we can acknowledge what they are doing is to give them an award. The way we select awardees, is a very strict process, and we make sure we select the best every year. So this year we're going to have 7 as against the 6 Dr. Oni mentioned. Some of the recipients are pastors. One is a pastor from a church, because we have community, faith-based organizations as partners, where they allow us to do things in their churches or the mosque. So one is going to be, a pastor is going to be a recipient. We have a policymaker, a rep, will be, receiving an award this year. And we have other people working in different divisions at the Department of Human Services being recipient, because they've supported us in getting the word out there. Even when it's so difficult to have these conversations, they've always made room or created a space to talk about it. Sometimes very difficult conversations like that, you hardly get enough room to talk about things. But these people, they always create that space and make it possible for us to talk about mental health wherever we find ourselves or wherever we want to do that. So
I think it's a wonderful opportunity to give the community a glimpse into the people that may not be always on the front lines fighting for them, but are always working behind the scenes to continue this conversation and to also make sure that nobody is left by the wayside as we try to keep navigating mental health.
Sure.
I think it's very important. Now, what, if anything, do you all need for this event to be successful? As the visionary and as the co-founder or co-coordinator of this event, what are 2 things that you all would say we could use some support in this way? Because I'm sure someone's going to watch this and say, I can't be there, but I would love to support this event.
Well, in the past, we have some people who will call us to say they will not be able to come, but that they will pay for 2 people to get scholarship to come. And that's part of donation to do outreach for people who could not make payment. And so we've accepted something like that, a donation to sponsor other people to attend. We also have some agencies that will say, we'll bring you some tote bags for people to bring and take some things, even though they're advertising their own business, but they're also supporting us because you can use those bags to collect things from the event. And sometimes people may donate towards speakers because we pay stipend, honorarium to some speakers. So people donate in different dimensions. So we are ready to accept something like that.
Yeah, I think that's wonderful.
Yeah, and I think another way the community or anyone watching this, another way they can help support this summit this year is to get the word out there. Words of mouth really matters. If you need anything, please give us a call. If you want to attend and you are a community member, please give us a call. We have scholarships available right now. You can send an email or probably call any of the numbers that you see on our website. So the support we expect is for you to, for people to help us get the word out there. Put it on your social media page, the WhatsApp group. It's really important to advertise this.
Now, you mentioned the website. Can you please provide us with the web address so that people can look up the information and start to register and probably reach out to you about sponsorship to make sure that some people that need to be in that space get the support they need?
Okay. So the website is www.11thafricanmhs.org. I repeat, www.11thafricanmhs.org. That takes you directly to the website.
And then, are you all on social media at all so that
Yes.
people can stay connected to the work that's taking place outside of the event that is upcoming?
Sure.
Yes.
On Facebook, we have the African Mental Health Summit. If you just put that in the search, it's going to bring you to the Facebook page. And also, I think we have it on Instagram.
Yes.
We also have it on X. Yeah. Where else? Yeah. That's it for now.
I love hearing that you guys are expanding your horizons to reach different demographics, because some people are Facebook people, some people are X people,
Very true.
and then there's the people that fall in the middle that are Instagram people. So I think it's a wonderful opportunity for people to stay connected to you all, but also to hear about what's unfolding with your organization, because you guys are doing work that is not just this event. So hopefully people are getting the information necessary, but also maybe looking up some of the names of panelists and things like that in organizations and figuring out how they can start to connect with them in a broader way.
That's good.
For people that may have not caught it, the African Mental Health Summit is taking place Friday, July 11th at the Heritage Center of Brooklyn Center. It is 6155 Earl Brown Drive, Brooklyn Center, 55430. And it is taking place from 9 a.m. to 4:30 p.m. Now, lastly, I just want you, Dr. Oni, to look at this camera here, to introduce yourself and that of the organization which you represent, and invite viewers to come to the Mental Health Summit.
My name is Dr. Richard Oni. I am the director and the executive director, as well as director of training for Progressive Individual Resources Incorporated. And we are based in St. Paul, Minnesota, and we have been part of this organizing African Mental Health Summit for the past 11 years. And we are employing you guys, whoever is listening and watching us this afternoon, to please spread the word and attend the 11th African Mental Health Summit 2025.
My name is Tolulope Ola. I'm the founder and executive director of Restoration for All, Inc. It has a mission of, getting individuals the awareness that they need using cultural strategies. And we do this around mental health and any other health issues that we have in our community. For the African Mental Health Summit is the 11th one. We are inviting everyone to be part of it. We don't want, the fee to be a barrier. We want community members to be part of this. Please send us an email or give us a call to let us know your intent to attend. We have scholarships available, but it's limited. Just like Dr. Oni said, please take action today to be part of this gathering. Thank you, and we'd love to see you there. Thank you.
Thank you both for being guests on this episode of Community Connections. I think it has been a very poignant conversation, and I am humbled to have both of you here talking about the necessary work you all are doing to impact our communities for the better.
Thank you so much
for
inviting
inviting
us.
us. We
Absolutely.
appreciate this. This is nice.
Thank you. I appreciate that. Make sure that you reach out to the team at the African Mental Health Summit 2025 on their website or their social media. They also have detailed phone numbers there for you to contact them if you have any questions, comments, or concerns. But also make sure that you and someone you know reach out to them and join them on the 11th of this month from 9 a.m. to 4:30 at the Heritage Center in Brooklyn Center. There's going to be some really poignant information and I think some resources that you or someone in your network may find useful. Unfortunately, that is all the time that we have for this episode of Community Connections, airing right here on OROMIA11. I'm your host, Anna Orr, and I look forward to connecting again with you soon. Thank you.